Good afternoon. It's Mark McClellan again. Welcome back to our main session, and I hope you all are enjoying the lunch. I hope you all had a good time at the plenary sessions this morning and in your breakout sessions. Certainly have been I've found them very informative, and we're going to continue that right now with this working lunch. The need to address and reduce racial and ethnic disparities is a major focus, as you all know, of our high-value healthcare project, which is working to make valid, timely, consistent information about the quality and cost of healthcare widely available, and to make sure that that information can be used to get demonstrable improvements in care and drive us to a healthcare system where the environment supports better care at a lower cost for everyone, particularly for people who face barriers because of their race, ethnicity, income status, and language, and other issues. So information is very important in taking some steps to address these problems, and we're very fortunate to have a keynote speaker today who not only knows how important information is, but most importantly knows what can be done to actually use it to lead to better care. So I'm very pleased to introduce Dr. Regina Benjamin, the 13th Surgeon General of the United States, who will be discussing the importance of placing equity in the context of quality improvement and healthcare reform. You all know her story, I think, in many cases. I had a chance to talk to a number of you about this conference. I know many of you were looking forward to this as a highlight. Dr. Benjamin served as founder and former CEO of the Bayou La Batre Rural Health Clinic in Alabama, and as former Associate Dean of Rural Health at the University of South Alabama College of Medicine in Mobile, as the immediate past chair of the Federation of State Medical Boards of the United States. She was the first physician under age 40 and the first African-American woman to be elected to the American Medical Association Board of Trustees. She served as president of the American Medical Association Education and Research Foundation and chair of the AMA Council on Ethical and Judicial Affairs. Then in 2002, she became president of the Medical Association for the state of Alabama, making her the first African-American female president of a state medical society in the United States. You see a general pattern here, don't you? Along with her many accomplishments, she has continued to focus, never losing sight, on the populations most in need. She's established a clinic in a small Alabama fishing village to help its uninsured residents. She supported victims of the hurricanes in the Gulf. She's gained national prominence for her business acumen and her humane approach to preventive medicine, and she has made prevention a core part of her mission in the Surgeon General's office. So we are very pleased today, very pleased and honored to have her with us today. Vice Admiral Benjamin, please come and address us. Thank you very much.
Thank you, and good afternoon. It's really is nice to be here with you. Thank you, Mark, for that wonderful introduction. And I'd also like to thank the Brookings Institute and the Robert Wood Johnson Foundation for bringing such a magnificent group of people together today. And I wouldn't dare try to talk about quality to the experts, because you guys are the experts here. So I thought I'd just kind of tell you a little bit about some of my stories, and I thought I'd start with a story that many of you may have heard, and if you had, just bear with me. It's a story about a young ensign who had duty on a battleship one night, and he had the watch, and everything was going quiet until he saw a light in the distance, and he plotted out the course, and he realized that it was in the direct path of a great battleship. So he flashed out a warning: you are in direct path of a great battleship. Alter your course. Reply came back: no, you alter your course. So he got his captain, and the captain came and assessed the situation. The captain plotted out the course, came to the same conclusion, and the captain flashed out a warning: you are in direct path of a great battleship. Alter your course. Reply came back, no, you alter your course. So by this time, it was getting pretty late, and they had to wake up the Admiral, which, if you notice, I'm an Admiral too. So, but like any good CEO, he said, if you want something done right, you do it yourself. So the Admiral plotted out the course, came to the same conclusion, and so the Admiral flashed out a warning. You are in direct path of a great battleship. Alter your course immediately. I am an Admiral. They waited for a reply, and no reply. They waited, still no reply. Finally, the reply came back, no, you alter your course. I am a lighthouse. Well, you and I have to be lighthouses and stand our ground to change those great battleships that we know are moving in the wrong directions. Those battleships like health disparity, the uninsured and the underinsured, the underfunding of Medicaid and care for the poor. And as you know, a few days ago, we certainly began to change the direction of some of these same battleships with that historic signing of the health reform legislation. People often ask me what they should address me as, what they should call me. Should they call me General or Admiral, or what do they call me? And I actually prefer to be called Doctor, because that's what I am. But my title is Surgeon General, but the rank on the uniform is actually that of a 3-star general. And that's really because I lead the United States Public Health Service. And the Public Health Service originated as a service to provide health care to merchant Marines. And the uniform is modeled after the Navy as a tribute to the public health's nautical roots. And so the Public Health Service really was created in response to a deadly outbreak of yellow fever that devastated the people of Philadelphia in 1793. And that city was then serving as our nation's temporary capital. And that epidemic killed 10% of the city's population and drove a third of the residents out of town. And it was actually unknowingly brought to Philadelphia by the merchant sailors, who were a vital part of the free flow of commerce to the livelihood of our young country. And the then President John Adams signed into law a bill that was creating a national health system of hospitals to treat merchant sailors. And just like today, they were on the brink of a new health system. But today, our commissioned corps officers are 6,500 officers who administer health programs across the country and abroad. And we also provide health care to people in health clinics, Indian reservations, and federal penitentiaries. And we also recently had officers on the USNS Comfort and on the ground during Haiti. And so that's why I'm in uniform, but you can still call me a doctor. So, I'd like to share with you a few of my personal experiences and basically a few of my priorities. And people often ask me how I got involved in all of this organized medicine and things, and I've told some of you, but basically when I was an intern, I attended the Medical Association of Georgia's annual meeting, and one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. Well, I stood up in a room of maybe 15, 20 people, and I said there was a need. I had never seen certain diseases except in a textbook. The reference committee agreed, and they passed a resolution. And they forwarded that resolution to the AMA. And Georgia sent me to the AMA to speak to the same issue. And again, that resolution passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference, whether it's in medical policy or in medical practice. And I learned that I can make a difference in medical practice when the National Health Service Corps sent me to Biola Battery. It's a pretty place, but it's a poor place. I found a community of working poor, too poor to afford medical care, but too rich to qualify for Medicaid. I liked the people, I liked the community, and I wanted to practice medicine there. But I quickly learned that practicing medicine wasn't just sewing up the shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape dispensers, and what I jokingly call the hammerheads, the lawyers. But I also learned that there were things that my prescription pad couldn't take care of. I learned that things like adequate housing, especially after Hurricane Katrina, employment opportunities, clean water, things like that, a prescription pad just by itself couldn't take care of them. So I stayed involved in every organization I could, from the Medical Society to the Chamber of Commerce, Girl Scouts, any organization that would help me get services to my community. A couple of patients kind of highlight that. One of the patients I had was a young girl, 20-something years old, named Donna, and Donna was a young white female in her early 20s, and she had seizures. And her seizures were under control, but all of a sudden she started having seizures. So when she came in, I said, Donna, what's different? And I have my patients write things down for me in case they forget if we start talking about other things. So she drew for me her pills, and she said, Jim, our pharmacist used to give her this one that was two-toned or striped, and now, and one solid. Now she got two solid ones, and she didn't know which ones to take. What had happened was our Medicaid program went into an HMO, and Donna didn't know how to read because she then got generics, but she didn't know how to read. At 20-something years old, in today's world, she couldn't read. Another patient, Willie, 40 or about in his mid-40s, but he had a speech impediment, and he grew up. He didn't really go to school, but so he wasn't really educated. But if you asked Willie to do anything, he'd do whatever you ask. If you say, don't, lower your cholesterol by don't eat the grease, he would follow your instructions. And he did odd jobs around the town. He cut his hand and got infected, and he had to go in the hospital. And when he was ready to be discharged, the social worker went and talked to him and said, we have home health set up for you. We have your medications. Is there anything else you need, Willie? And he said, the social worker happened to be a Catholic nun who wore her habit. And he looked at her and said, can you teach me to read? And I knew that no matter what I did with the prescription pad, we needed to get some help, some literacy, adult literacy programs in our community. Community is so important, and getting that literacy program was just as important as writing that prescription for hypertension. Another patient, Mrs. Smith, I stop all the time because I want to say her real name, but HIPAA won't let me. So she is about 40, African-American female, kind of short, overweight, and Mrs. Smith called me on one Saturday afternoon, and she was in so much pain, I could hear it in her voice. And she says, well, Dr. Benjamin, she had a ruptured disc, what we call a slip disc. And she was in so much pain. She says, Dr. Benjamin, I'm really hurting it. I went to see that specialist you told me about, and he told me to lose weight. I'm really trying to lose weight. I promise I am. But that ibuprofen is just not strong enough. Can you call me in something stronger? I said, sure. I'll call you in something stronger, but you've got to come and see me on Monday or Tuesday. She says, okay, I promise I will. And sure enough, I walk in the exam room on Tuesday, and she's leaning over the exam table because she's in so much pain that she can't sit down. And I said, well, Mrs. Smith, did you get the medicine? I mean, did it help at all? Did the medicine help? She says, well, I didn't get it. I said, what do you mean you didn't get it? She says, I couldn't afford it. I said, but you work at the school. You work in the, at the elementary school. She works in the janitorial custodial area. I said, you work at the school. You have Blue Cross. You couldn't get it? She says, no, I didn't have the copay. But I get paid Friday. I promise you I'll go get it Friday. So I stepped out of the room, and I had my nurse, Nell, go across and have Jim get her medicine for her. And after seeing another patient or so, I went back in to see her. And I handed her her medicine. I said, you're in a lot of pain. You really need to take your medicine. And her eyes teared up. And she was tearful, and she says, oh, Dr. Benjamin, I'm so embarrassed. I'm so embarrassed. I didn't want you to do that. I'm really embarrassed. And I realized that I had made a major cultural mistake. I'd taken her dignity from her. And cultural competence doesn't have to do with your race. It doesn't, because we were the same race. It has to do with the fact that you have someone maintain their dignity. And so I was like, how am I going to get out of this? But, so as I told her that, we have people, particularly after Hurricane Katrina, that would send us donations, and we had a small pot of money that would help people with their medications just in special times, just like hers. And that's what they sent it for, and that's the money that we use. And if she wanted to pay it back on Friday when she got paid, she could, but she didn't have to. And she was okay with that. And so as I was leaving the room, I heard a familiar thing. She says, "Oh, by the way." And the "oh, by the way" was, she said, "Can I get a work excuse?" I said, "Sure, today is Tuesday. Start taking your medicine. Do you want to go back on Thursday or Friday?" She says, "No, I have to go back tonight. We have to strip those floors from wax." So here is a woman who can barely stand up because she's in so much pain, but she's willing to go and strip the wax off the floor so our kids can go to school in clean environments. And those are the people that we advocate for. Those are the people who need our voices, need your voices. And those are the folks who really depend on us to help them and speak for them when they can't speak. As you know, as you can tell, probably I really miss patients, and it was really tough for me to be able to leave Biola Battery after 23 years, and because the patients are like family. But as I said, I didn't really leave them. I actually just moved to D.C., opened a satellite office, and now I have, I have 300 million Americans as my new patients. So as America's doctor, I want to provide Americans with the best scientific information available and on how they can live healthier lives. I also want to try to bring some clarity and understanding to this overwhelmingly confusing conversations about health and health care. I'm really grateful to have this opportunity to be here and to serve in this very historic time. We're making very long overdue changes in how we finance and deliver health care, changes that will eventually give all Americans access to high quality, affordable health care and the care that they deserve. However, giving Americans and health care coverage is just the first step in a truly reducing health disparities that's plaguing our country. Disparities not just among minorities groups, but also among social groups as well. We do know that reducing and ultimately eliminating health disparities is going to require more than just giving Americans an insurance card. The second step is probably the more difficult step and the more challenging one, and that's to transform our health system from a sick system into a wellness system, a system that's focused on prevention at all levels, primary, secondary, and tertiary prevention. And as you know, prevention is the foundation of our nation's public health system, and prevention is the foundation of my work as Surgeon General. And so as Surgeon General, my priorities focus on wellness and prevention. And in January, actually January 23rd, I released my paper, this first paper ever, the Surgeon General's Vision for a Healthy and Fit Nation. And we released it at a press conference here in Virginia, and I was joined by Secretary Sebelius and First Lady Michelle Obama. Because perhaps the most serious challenge to the nation's health and well-being today is obesity. And since 1980, obesity rates have doubled in adults and tripled in children. And the problem is even worse among Black, Hispanic, and Native American children. And needless to say, we've been working on this issue for some time. And in fact, in 2001, former Surgeon General Dr. David Satcher released his paper called A Call to Action to Prevent and Decrease Overweight and Obesity. And in his paper, he warned us about the negative effects that weight gain and unhealthy lifestyles were having on the health and well-being of Americans. And so now I followed up on his report with my first paper, the Vision for a Healthy and Fit Nation. And in that paper, I lay out ways to respond to the public health issues that were raised 9 years ago. And although we've made some strides since 2001, the number of Americans who are struggling with their weight and health conditions related to their weight still remain much too high. And most of you know the often repeated statistic that today in America more than 2/3 of adults and 1 in 3 children are overweight or obese. And we're seeing the sobering impact of these numbers in the high rates of chronic diseases such as diabetes and heart disease and other chronic illnesses that are starting to affect our children more and more. And just about a week or two ago, a study from the University of North Carolina School of Medicine reported that obese children as young as age 3 show signs of inflammatory response that has been linked to heart disease in later life. So I was pleased to join the First Lady in launching her Let's Move campaign to solve the problem of childhood obesity within one generation. And both my vision for a healthy and fit nation and the First Lady's Let's Move campaign take a comprehensive approach that engages families, communities, as well as the public and the private sectors. You know, for years we've encouraged Americans to eat more nutritiously, exercise regularly, and maintain healthy lifestyles. But for these things to happen, Americans have to live and they have to work in environments that support those efforts. And there's a growing consensus that we as a nation need to recreate our communities and our environments so that the healthy choices are the easy choices and the affordable choices. And so my vision for a healthy and fit nation is an attempt to change that conversation, change this national conversation from one of a negative one about obesity and illness to a positive conversation about being healthy and being fit. And just this past Friday, I participated in a media event where $650 million of the stimulus funds went to a program called Communities Putting Prevention to Work, and they were aimed at obesity and tobacco prevention. And I'll just share with you a couple of my other priorities besides obesity, but is, of course, tobacco and moving toward a smoke-free society. As you know, we've done very good in tobacco cessation, but we've stabilized now and we're not moving. And we're really fearful that if we don't do something to go that extra step to become a smoke-free society, those curves will start moving in the wrong direction. Another issue I'm interested in is HIV/AIDS, especially in women and girls. And violence, another area is violence prevention in society. Too many times we turn on the TV almost every day, we're seeing some form of violence, either youth violence, domestic violence, violence in the workplace, violence in the public areas. It's gotten to a level of public health interest that we need to do something about it. Another area is medication adherence. Many of you know you'll see people come in with a bag full of medicines. They don't know what they're taking, and the doctors don't know what they're taking either. And how do we get people to take the medicines as they need to take them? How do we make it easier for them? How do we make it easier for the doctors and the nurses to help them? And it may be IT, it may be a number of things, but we need to find out how we can do that better. Of course, mental health and substance abuse is also a major issue. And throughout all of this, all of these things is working to eliminate health disparities. As you can see, I'm a family doctor, so I like everything, so I'm open to new ideas. So, before I close, I want to talk a little bit about leadership, because that's one of the things I kind of like is leadership. I had the opportunity to participate along with a few of others in the room for some formal leadership programs. I was a Kellogg National Fellow and a Rockefeller Next Generation Leader. So those formal programs basically teach you what leadership styles are. And I came away with 2 leadership styles that I kind of like. And one of them is the servant leader. And the servant leader, many of you know, all of you know about. You lead by serving, and it's not for the glory, it's not for the fame, it's just because something needs to be done and you do it. And I have lots of examples of those. But the other leadership style I call leadership from behind. And that's where when you rise to a level of success that you don't forget to reach back and pull someone else up with you. And to make sure that they are also coming to become leaders. But a great leader doesn't stop there. They'll push them out in front of them and make them even better than they were. And in addition to pushing them out, they'll do like the young kids say. They'll let them know they have their back, so that if they're out there, they know that if they stumble or start to fall, you're going to be back there to support them and keep them up. Oftentimes, we do that by encouraging kids to do things. And I had a program called AHEC. Many of you may know it's Area Health Education Programs, trying to get young kids to go into health careers. So we would take kids around to various places to show them schools and things. And there was an 8-year-old girl who we took to this very nice institution. Actually, I won't say which institution, but a nice school. And she was so excited. She was just so excited. She says, the place is so beautiful. The building is so beautiful. When I grow up, do you think they'll let me clean? And so the question was, what do we say to her? Always did say, I didn't want her to think cleaning is bad, because many of our family members clean, and there's nothing wrong with that. So I told her that she could sit in those desks and those chairs, and she can get an education. And once she graduates, she can start her own business and get a contract on every school in the entire state if she likes. But she had that opportunity to do that. I also had the opportunity to serve on the Sullivan Commission for diversifying the healthcare workforce. And it was named in honor of former Secretary of HHS, Dr. Louis Sullivan. And the commission went around, we had public hearings, and we issued this report that some of you may have heard of called Missing Persons, Minorities in the Health Professions. And the commission found that while 25% of the nation's population is minority, only 6% of the physicians are minority. And that's the same percentage as during the Flexner Report of 1910. And less than 9% of nurses are minority. And so although our minority populations are increasing, in recent years, there's been a downward trend in the minority enrollment in our nation's medical, dental, and nursing schools. And unless we change these current trends, or unless they're really quickly reversed, our nation faces a growing ethnic and racial disconnect between those who seek care and those who provide that excellent care. So I would encourage you to, because you're the leaders in your communities, just if you see someone, encourage them to consider health careers, encourage them to go to school for anything, but I'm kind of partial to health careers. And as you know, we need more primary care physicians now and primary care nurses, and so whatever you can do. And all it sometimes takes is just a thought from you, from somebody they respect, and they will try to make you proud of them. Because you never know who's watching you. You just never know. I used to get my name in a paper, or I remember being on a magazine or something, and reporters will call and ask the same questions that they already know the answers to. So I would be seeing patients like, I don't have time to talk to a reporter. And I'd put them off until one day I got an envelope in the mail, a manila envelope, and it was full of letters from a second grade class. And each one of those letters said, I want to be a doctor just like you. And I knew that my picture and my name in the paper had nothing to do with me. It was about the second grade class. And if one of them became a doctor or a nurse, it was okay. Or a pharmacist or anything. It was worth it. So I started answering reporters. It was like all the time. The other place where you don't know who's watching you, when I was on the AMA Board of Trustees, we had these huge meetings, several thousand doctors there, and the board would meet in the mornings before and in the evenings later. And the board had a boardroom where it was kind of an impressive boardroom. Each person had their own microphone, and there was a section in the back for staff, and so it was kind of a big deal. And I was the only African American on the board at the time. Well, only African American ever since. Lonnie Bristow was president before me, but anyway. But I was also one of two women on the board. And so I went back to get something off the table, and this older gentleman was cleaning up, and he says, "Ma'am, can I say something to you?" And I said, "Sure." He says, "We're very proud of you. We know you're here, the ladies in the kitchen. I even told my granddaughter about you. You never know who's watching you, and you never know what influence you're having." And so it's a tough responsibility, but you're up to it. So just make sure that you realize that people are watching what you're doing. And while you're doing all of that, make sure you take time for yourself. When you fly those airplanes and that steward or stewardess comes on with the announcement, and she says, "Put your own face mask on before attempting to help others," you need to put your own face mask on. You need to exercise, rest, have fun, play, because if you're burnt out and tired and exhausted and grouchy, you're really not any good to anybody. So it is important that you put your face mask on and that you so that you can be there, so that you can continue to set those good examples. And finally, I'm going to end with another story. I'm full of stories, but all my stories are around water. But there was a young lady who was jogging along the beach one morning, early one morning before the sun came up, and there was an older guy tossing starfish in the water. And as she ran by, she'd see him toss these starfish. And so by the time she got through with her run, she just couldn't take it anymore. So she went up to him and she says, "Why are you tossing those starfish in the water? There are hundreds and hundreds of starfish along the beach. And as soon as the sun comes up, it's going to burn them off and kill them all anyway. It's not going to make a difference. Why are you bothering?" So he looked at her, reached down and picked up a starfish and said, "Because it makes a difference to this starfish," and tossed it in the water. I hope that this conference will help you and go out and find your own starfish and make a difference in their lives. Thank you so much, and I'm so pleased to have been here with you. Thank you.
So I would actually like to just have one more round of applause for Dr. Benjamin. And we are going to be starting with our breakout sessions at 1:30, so I think we have a little bit more time to eat, and then everybody can go off to their breakout sessions after that, so thanks very much.